video is about Artline sampling off of your VAMP system. So what a VAMP system is, it's called a venous arterial blood management protection system, and there's two main advantages to it. One is we aren't using the waste syringes, so we don't lose blood in the process. The only blood we take out of the patient is for the arterial sample. The other advantage is there seems to be less infection associated with these systems. You will tend to see a VAMP system used on patients in ICU or more long-term type care patients. So the VAMP system is here. There is a little sampling port. Here there's a stopcock. This is our little plunger VAMP system, so this is our reservoir to collect blood. And then there is your pressure transducer. Note that this transducer is placed on the upper arm. As long as it's at the patient's phlebostatic axis, that's fine. You'll often see them mounted in the transducer holder as well at the appropriate level. So to do the procedure of sampling off of this system, you need to first check your doctor's orders for it. Obtain your requisition, where you're going to fill it out with your ventilator settings or the patient's spontaneous parameters, and you need your patient label to put on the syringe. The other equipment you're going to need is the blue pad. Again, most RTs you see working clinically don't use this, but until you're used to the system and you can avoid any blood spills, I recommend using it. You also want your biohazard bag, gloves, an arterial blood gas syringe. This, again, in the lab, we're using arterial blood gas kits, so there is a needle in there that you don't need. We will discard of that in the sharps container. Blunt plastic cannula, a little bit of gauze, and some alcohol. So whenever you're doing your procedures, remember you always need to identify yourself and your department, check the patient's ID, so look at their wristband, and then explain a little bit about the procedure. Again, when we're sampling off the Artlines, there's no needles to the patient, so it is not an uncomfortable procedure for them. Now, to actually do the procedure, the first thing you want to do is wash your hands. Then you're going to put on your gloves. And like with the three-way stopcock method, you do want to silence your alarms first. So go to your patient monitor, which would be turned on, but silence your alarms, and then you're ready to do the sampling process. So set up your equipment. Again, we just need the syringe. We can discard of that needle later. With the arterial blood gas syringes, remember they can be vented or non-vented. The non-vented ones typically have the rubber black plunger, and you want those pushed all the way in like this. If it is a vented syringe like this one, you can withdraw to 1 ml, your sample size. So put that aside with the cap, and put your blunt needle on this as well. So the gauze, again, is to try and protect from a little bit of splatter that can occur when you're going into that rubber port. So you can alcohol this before or after you withdraw the plunger. We'll alcohol it before. That way, this will give it the 30 seconds to dry. The next thing you can do is pull back slowly on this plunger by pressing on the sides and then pulling back. And you will see the blood coming out of the arm. It's quite diluted, pale pink. And it's mixing in this chamber. So all that heparinized fluid and the blood mixes here, leaving you a pure arterial blood gas sample here. When you are pulling back on this plunger, make sure to do it over 3 to 5 seconds. You don't want to compromise the blood flow down to the hand. So once we pull back and we're at the full length of the reservoir there, turn the stopcock off. So now when I sample from this port, the blood can't come from our reservoir. It will be coming from the patient's Artline. So we've alcoholed and let that dry. Now you can inject using your gauze to protect your arterial blood gas syringe, and withdraw your 1 cc of blood. Now set that aside and we'll cap that later. Again, we want to clear this line of any blood because we don't want clots to develop. So to do this, make sure you open that stopcock again to allow the flow. And now we're going to depress this plunger, again over 3 to 5 seconds, pushing that blood back into the patient. So opposed to the three-way stopcock method, that blood would have been wasted, and this way we aren't taking it away from the patient here. The last thing you want to do is clear any residual blood from the line using your flush system. Again, intermittent flushing, so we don't compromise blood flow to the hand. Check for any complications, so make sure your catheter is still in place, it's not leaking, there's still good perfusion to the hand. And now going to your patient monitor, you should still see a good arterial blood pressure waveform and a similar pressure reading to before. And then you want to activate your alarms. Now we can cap our blood sample. Make sure there's no air bubbles in it. Place our cap on it, the patient label, and put that in the biohazard bag. Gather up all the garbage for the garbage can and make sure you dispose of your sharps in the sharps container. So, last thing I will do with this in the garbage is wash my hands and then go chart the procedure, and then I'll go run the blood gas sample.